One is that healthcare is a right. And I think that understanding that acknowledgement needs to undergird any efforts that we have moving forward. The second one is that to address health disparities, we must address the social determinants of healthcare. And that is something that we have not really focused on disease for a long time. And I think to the extent that we have ignored the social determinants of health, we find ourselves in the position that we're in today, where over 200 people of African descent die prematurely from preventable causes every day in this country. And I think I'm missing one, but I'll come back to the one that I'm missing. But the last one is that an investment must be made. And I'm very glad to see that our president-elect has said that he is committed to ensuring universal coverage and health care access for everyone, and equal education, which is really tied to it, for every child in this country, despite the cries of spend, Democrats spend all the time. But he's remained committed, and we're in the caucus are going to continue our push for an investment in prevention, because we know that that is the only way, not only to eliminate the disparities, but to rein in the escalating cost of healthcare. And then we have several other priorities underneath that. And I'm missing one of my principles, and I didn't bring them with me. I just got back from a trip, but I'll come back to it. But sure. Some of the principles involve, of course, coverage for everyone, including legal immigrants. Making sure that our providers are taken care of, that they get the kind of support that they need to continue to practice in our communities. Making sure that we increase the diversity in the healthcare healthcare workforce. To me, that is a critical piece of eliminating disparities. We must have healthcare workers on all levels, from the community health worker all the way up to the policymaker, that represent us, if we are ever going to close the gaps in healthcare. And I'll probably stop there and
we'll come back.
Respond to questions, and I'll remember what my fourth principle
Sure. Well,
is.
let's go back to Dr. Richard Allen Williams. And Dr. Williams, you've tried to lay out the pervasive and historical issues associated with disparities in health outcomes for African Americans, and you've done it in the book. The book, as I said before, is Eliminating Healthcare Disparities in America, and you've collected a number of scholars from the African world talking about areas of their expertise. Tell us what the findings are, in summary, in this book.
Well, first of all, I want to mention that all of the scholars are not African American. There are several other ethnicities represented as my co-workers on producing this book. And I think that's important because we wanted to present a broad perspective from several vantage points on this problem. Now, as far as the book is concerned, I'll just briefly describe it. It, first of all, is based on and emanates from what is called the Institute of Medicine, or IOM report, which came out in 2002 from the Institute of Medicine. And it was a report on the medical treatment, specifically of minorities in this country, and the disparities in that treatment. And it was subtitled Unequal Treatment, in fact. What it found is what you might expect from that title, and that is that our healthcare delivery system is imbalanced, unequal delivery to various parts of our population is concerned. And the recommendation was that that must be changed. My book took off on that and tried to extrapolate to, first of all, give more evidence about the healthcare disparities, which I have defined, and also to talk about what not only the background of the problem is and the status of the problem, but also what we might look forward to from the standpoint of solving those problems. And I think that what we have to do is to focus on that aspect of things.
Okay, I think we've lost that connection momentarily, but we'll continue in a minute. The joy of modern technology. You know, this is a wonderful use of technology to connect what we call locally and globally, to have this conversation on both coasts and here in Twin Cities. But while we're here, let me turn to the local guest. Mitchell Davis, you just finished an important conversation that mirrors the concerns discussed by our esteemed speakers from the East and West Coast. You recently conducted a Office of Minority and Multicultural Health discussion and conference on disparities in Minnesota. Tell us about what you did locally here.
Last week, Al, we certainly had the 2008 National Health Disparities Conference, and it was entitled Health Equality, Honoring Culture While Closing the Gap. And within Minnesota, we all know that we have our tremendous populations of color American Indians that are growing all around the state. And so we brought all of us together last week for a 3-day conference to really focus on health disparities. And we covered not only health, chronic disease, but we also had a speaker, Dr. Gail Christopher from Kellogg Foundation, who talked about the racial dynamics of what sits at the bottom of this health disparity. We talked about social determinants, which means my education, my income, where I live, what air I breathe, to talk about how that impacts our health.
The question to me was about policy and legislative initiatives.
Go ahead.
And we have introduced with the other minority caucuses a bill called the Health Equity and Accountability Act. It was introduced with the Hispanic Caucus and the Asian Pacific Caucus, and it addresses several areas that we feel are important to address if we're going to eliminate health disparities. It speaks to data collection by race, ethnicity, and socioeconomic factors, addressing individuals with limited English proficiency and setting some standards and some training around translating for medical purposes. It has a large section on increasing underrepresented minorities in the workforce on all levels, including policy fellowships. There's a title that addresses some of the leading causes of health disparities and how we provide comprehensive care from prevention all the way through to really address that. There's support for our facilities and our institutions in that bill. And then there are other special provisions like border health, Indian Health Service, and other areas. And very importantly, there's a title that deals with accountability. So in that bill, we would strengthen the Office of Minority Health. We would strengthen the Office of Civil Rights in the Department of Health and Human Services. And the other important part of that bill is creating health empowerment zones, which basically put the resources, the information, the technical in the hands of the community itself that is suffering from these health disparities and enables them with help from any agency in the federal government or all agencies in the federal government according to their plan, if they're designated as a health empowerment zone, to address those challenges and reduce the gaps in their own community.
Let me ask Bill Davis and Clarence Hightower to join the conversation at this point. We'll come back to you, Mitchell Davis, in a couple of seconds here. You all are charged with organizing people in the community, your organizations, Community Action Partnership in St. Paul here, Community Action of Minneapolis. These organizations have major responsibility in translating and delivering organization assistance, aid, opportunity to people of color in Hennepin and Ramsey and Washington County. The challenge now is how do you mobilize? How do we organize from the ground level so that our people both understand and can access or acquire the assets, resources, solutions we need to improve our quality of life. Let me ask you first, Clarence Hightower.
Al, thank you. And Al, you might remember that in 2004, when I was president of the Minneapolis Urban League, we produced this book called The State of Blacks in Minnesota. Mm-hmm. And I believe that it was the first comprehensive treatment of how disparities are impacting people of color in the state. And clearly we looked at how health